So this study is part of an international collaboration and uses high-quality relevant data on thyroid cancer incidence in children and adolescents below the age of 20. And what we have observed is that incidence rates of thyroid cancer have increased substantially in the past 1 or 2 decades. So there is now a consensus in the community that thyroid cancer incidence rates in adults are driven by overdiagnosis. With these studies on children and adolescents, we have observed similar features. For instance, the geographical variability across countries is almost entirely explained by papillary subtypes, which is the one with the best prognosis and the one for which we know that there is a reservoir of subclinical disease. Another important feature is the fact that mortality rates did not change substantially over time for all age groups. So in adults, overdiagnosis of thyroid cancer is already a public health issue and is a problem that is expanding in many countries, also low and middle income countries. With this study, for the first time, we see that this problem might also be relevant for children and adolescents. In this category, in younger categories, the problem is smaller compared to adults, but for the individuals, the problems might be more important because they affect them very early in their life. So in our study, we propose that, like it already happens for adults, that asymptomatic populations of children and adolescents without specific risk factors for thyroid cancer should not be screened. Overdiagnosis of thyroid cancer causes overtreatment, and it affects predominantly young adult females. The vast majority of individuals who are overdiagnosed with thyroid cancer undergo full thyroidectomy, which might occur very early in age, and consequent also lifelong hormone therapy, causing a loss in the quality of life. Overdiagnosis also causes a waste of resources for the health systems and for the individuals.